Hello, the NHS costs us as a nation £2 billion a week, and it does a great job. But with budgets set to tighten, how can we make sure that the quality continues to improve and we continue to get value for money? Well, a unique collaboration between the Audit Commission and the Academy of Medical Royal Colleges may just have found the answer. And it's this book which shows just how important it is for doctors to get to grips with hospital finances and how they work, and how they can use their budgets to be more effective. Joining me to talk about this work now is Professor Dame Carol Black, the Chair of the Academy of Medical Royal Colleges, and Andy McKeon, the Managing Director of Health at the Audit Commission. So first of all, Andy, how did this publication come about?
Well, it's quite simple, really. It's doctors who spend most of the money in the NHS by the decisions they make about treating patients. Now, we did a study of those hospitals which had failed financially and failed their patients. And the one thing about those was that the doctors were not engaged in the management of the hospital or in the management of the finances. So getting doctors engaged in management and finance is important for patients.
So what are they going to get from reading this book?
I think they're going to get three things from reading this. First, they're going to get a good overview of how NHS finance works. Secondly, they'll get a real insight into how the budgets and finances in their hospital work. And lastly, they'll get some great examples of where doctors have become involved, have taken control of the money and have made a real difference for patients.
But Carol, is there still that kind of culture in the NHS of them against us, we're the doctors, they're the accountants?
Well, perhaps to a small extent, but there are some wonderful examples now around the country where doctors have got involved in management, have got involved in the financial affairs of their hospital, and they've made a real difference to the delivery of their service and to patient care. So I think we're living through changing times.
Yeah, changing times, but how much do you want the doctors to change? Do you want them all to become qualified accountants, Andy?
No, it's not necessary at all for doctors to become qualified accountants. But we do think that they ought to know the basics of how NHS finance works and the basics of their hospital financing and budgeting. I mean, if you looked at any other industry or firm and the senior management, senior professionals didn't know about how the money flowed, I think you'd find that quite extraordinary. Yeah. So, no, we're not looking for qualified accountants, but we do think they need to know the basics.
Yeah, and I suppose the most important question of all, Carol, is what impact, if any, will this have on patient care?
It'll have a definite impact on patient care, because if, as Andy says, you're engaged in the management of your hospital, in its financial affairs, you're engaged in the whole business of patient care, and you will be more efficient, you will have a better quality service, and very importantly, I think you'll enjoy your job more because it's the whole thing.
I think that's very important, actually, because if you're not involved, you can block things, you can stop things happening.
Yeah.
But by getting involved, by actually taking control of the money, you can actually make things happen, make things that you want to see happen for your service, for your patients.
I'm sure that's right, but aren't there enough bean counters already? We've heard for years criticism there are too many bean counters, too many accountants, too many managers in the NHS.
Well, the finance professionals do an important job, but the fact is they don't spend the money. It's the doctors who spend the money. So it's no good relying on the finance professionals. You have to have the doctors and the finance professionals together if you're going to make best use of the money that's there.
How do you think doctors are going to react to this, Carol?
I think they'll react well. I think if they dip into this book, they'll see wonderful case examples of how doctors have got involved, how they've improved the service for their patients, and they felt more in control. And that's very important. Doctors like to be in control. I think they could also see in this document how the NHS works financially. So I think they'll buy it.
And briefly, your vision of the future, Andy, this will just become a routine part of a doctor's job, will it, in years to come?
I think it will become a routine part, not a huge part, but a routine part of their job, by recognising that knowing about the management, being in control of the money, that's how they know they'll make a real difference for patients. OK, and just to remind everybody, this document is available now on the Academy and the Audit Commission's website, so happy reading, and thank you both very much indeed for talking to us. Thank you.
Pleasure.